I have the pleasure of talking with Lindsay today about the practical aspects of pancreatic enzymes from her firsthand experience. Thanks for being here today, Lindsay.
You're welcome.
So can you tell us about when you first started taking enzymes and what differences you might have noticed?
Sure. I was diagnosed with cystic fibrosis when I was 22 years old. I started taking enzymes probably about 11 or 12 years ago. When I was diagnosed, I was pancreatic sufficient, but over the years I developed some abdominal pain and bloating when I was eating meals, and further testing suggested that I was pancreatic insufficient. So I started taking enzymes with my meals, and I found right away that that helped with my abdominal pain and bloating, and those symptoms resolved with the enzymes.
So since you were an adult when you started taking them, do you ever have trouble remembering to take them, or how do you take them now in relation to your meals and snacks?
Most days I'm pretty good at remembering them. If my routine is off such that I may be eating out or eating somewhere else other than at home or work or whatnot, I can be off with that and may be late or maybe miss a dose, but most of the time I take them prior to meals.
And we know that enzymes need to match the food just like insulin, so we always recommend taking them before a meal. And if you're at a restaurant and you have a long meal, you can take some before and some in the middle. We estimate that the enzymes are active for about 30 or 40 minutes. So that brings me to the question of when you are away from home, how do you make sure that you have some enzymes with you?
So when I have the enzymes filled, I usually ask the pharmacy if they can make a smaller bottle with the enzyme prescription label on it. And then I will take either the stock bottle that they've given me or the larger bottle of enzymes they've given me, and I pour some of those over to the smaller bottle so that I'm always able to keep it with me either in a purse or in a bag or whatnot.
Great. We also know enzymes degrade after about 80 degrees or higher. How do you handle that when you're going to the beach or you're outside in the summertime?
So in the summertime, if I am out and about, I will probably pack a cooler and keep, food or whatnot in there, but I will put ice packs or either a little bit of ice in there, and then I keep the prescription vial in that container so that it's always cooler than what it would be in the summertime.
So I'm sure that gets a little tricky.
It
Trying
can.
to plan ahead for that.
It can.
Final question. So you are on Trikafta, right?
I am.
And did you change your enzyme dosing at all after starting Trikafta?
I did. After I started Trikafta, I developed some abdominal pain, and I increased the amount of enzymes that I was taking immediately after starting Trikafta. But within a couple of months of taking the Trikafta, the abdominal pain had subsided, and so I returned to the dosing of my enzymes prior to taking Trikafta.
And some people do find they can take fewer enzymes, and some people have actually stopped taking enzymes after taking Trikafta. We do recommend, though, to get a fecal elastase checked and just verify what your pancreatic status is before you change anything. So any other advice that you'd like to share?
Sure. I would recommend that you fill your enzymes prior to running out of them, because many times the pharmacy may need to order them, and often many times we're taking larger quantities, and so they may need to order them, and you don't want to run out. So I would recommend filling them in advance.
For sure. So thank you so much for helping us today, giving us your pro tips.
You're welcome.